Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about the enzymes in different diseases. Right, so here we have different enzymes in each disease. For example, we have cardiac biomarkers. So we have creatinine in cardiac biomarkers. We have creatinine kinase MB subtype. We have troponin I, troponin T, and myoglobin. Okay, all these are increased in mi. Okay, and in mi even there is LDH1 is increased more than LDH2. Normally there is LDH2 is present in more quantity than LDH1, but in mi there is LDH2 is present more than LDH1 is present more than LDH2 in mi. See, normally LDH2 is present more than LDH1, but in mi there is LDH1 is present more than LDH2, and this is called as. Now, we also have BNP. See, this LDH1 is present more than LDH2. This is called as flipping pattern of LDH. Okay. Now we have BNP. This BNP is brain natriuretic peptide, which is a marker of cardiac failure. Okay, so these are the cardiac biomarkers. Recently there are many new cardiac biomarkers which have been discovered, like we have ischemia modified albumin, and then we have glycogen phosphorylase BB isoenzyme. We have glycogen phosphorylase BB isoenzyme, and then we have pregnancy associated plasma protein A is present, and we have myeloperoxidase. Okay, all these are the newer cardiac biomarkers which were present. Then what about the liver diseases enzymes? If you see the enzymes in liver disease, okay, we have first enzyme, we have amino transferases. Amino transferases are actually more sensitive indicators for liver injury. So if you see AST, this AST is aspartate transaminase, which is present in liver, cardiac muscle, skeletal muscle, kidney, brain, and it is present in pancreas and also lungs. Okay, so these are the different sites where this AST is present. So if increase in AST can be due to any of these. Then we also have ALT, that is alanine transaminase. This alanine transaminase is primarily it is found in liver. So if you were asked which is more specific, that is AST or ALT, actually ALT is more specific than AST. Right? Then we also have some more important enzymes in liver disease, like we have ALP, 5-nucleotidase, GGT. All these are actually increased in serum in a disease called as cholestasis. In cholestasis, you will see that there is increased ALP, 5-nucleotidase, GGT are increased in serum, that is cholestasis. Then, if you see, ALP is increased both in liver and in cholestasis. But what is the difference? ALP is increased in less than 3-fold. If the increase is less than 3-fold, then it is liver disease. And if the increase is more than 4-fold, then that is cholestasis. That means, for example, if minimum value of ALP is 2, it's just an arbitrary value for better calculation. Do not take it as okay, granted. So if ALP value normal, if it is 2, then if this is 6, less than 6, then that is liver disease. If this is more than 8, that is cholestasis. That's what these less than threefold, more than threefold is. You will have to multiply the value, original value of ALP with this 3. Then less than that value, there will be liver disease. Similarly, you will have to multiply this value with 4, so that value which you have more than that, if the value of ALP is present, then you call it as cholestasis. Right. Next, if you see the GGT. Okay, this GGT can identify the presence of occult alcohol use, can be identified by this GGT. Right. Then for cholestasis, we said there is increase in ALP, increase in 5-nucleotidase and GGT. But among them, if you were asked which is more specific, the more specific among these is 5-nucleotidase is the one which is more specific for cholestasis. For cholestasis, this 5-nucleotidase is more specific, followed by ALP, followed by GGT. Right. Now, so this is about the main enzyme profile in liver disease. Then after liver disease, if you see, there is one thing which is important in liver disease, that is AST by ALT ratio. If this AST by ALT ratio is less than 1, then it can be due to chronic viral hepatitis, or it can be due to non-alcoholic fatty liver disease, toxic hepatitis, paracetamol toxicity. Then if this AST by ALT ratio is more than 2:1, then it is due to alcoholic liver disease. Okay, so this is how AST and ALT is differences. I mean, based on the value, you can come to a little diagnosis, or you can at least prioritize things. Then, what are the enzymes which are increased in prostate carcinoma? So, in prostate carcinoma, we have acid phosphatase is increased in prostate carcinoma. That too, the tartrate labile acid phosphatase is increased in prostate carcinoma, and prostate specific antigen, which is a serine protease, is also increased, or it is secreted by the epithelial cells of the prostate, and thus it is prostate specific. Then if you see pancreatitis, okay, in the pancreatitis we have two enzymes, which is amylase and lipase. If you see, this lipase is specific than pancreatitis, and there are many other conditions where amylase is increased other than this condition. Okay, then we have next about the markers of bone disease. So if you see, in the bone disease we have two things. There are markers which are present for bone formation, and we have markers for bone resorption. So if you see markers for bone formation, we have serum bone specific ALP is present, which is marker for bone formation, serum osteocalcin and serum propeptide of type 1 procollagen. So all these are the bone forming markers for bone formation. Then if you see markers of bone resorption, we have urine and serum cross-linked N and C telopeptides. Then we also have urine total free deoxypyridinoline. All these are the markers of bone resorption. So these are the two diseases, that is markers of bone formation and markers of bone resorption. Then if you see, there are some biomarkers for acute kidney injury. So what are the biomarkers for acute kidney injury? These include, first we have kidney injury molecule 1. Then we have neutrophil galactin associated lipoprotein, interleukin 18. We have alanine aminopeptidase and clusterin, which is a biomarker for acute kidney injury, gamma glutamyl transpeptidase, beta microglobin and alpha 1 macroglobin. Okay, liver fatty acid binding protein. Then we have ALP, then we have alpha glutathione, then we have osteopontin, retinol binding protein, exosomal fettuin, and sodium hydrogen exchange isoform. So all these are the markers for acute kidney injury. So this is about the different markers for different diseases. Thank you guys for watching my lecture. Thank you.
Thank you, and thank you for watching.